Hello, my name is Kyle Magatelli. I am the social media and webinar coordinator with the Student Doctor Network, and very happy to get to talk to MS3, Ms. Grace Shadid, and Dr. Naureen Kabani from SUNY Downstate's Patient Navigator Program. So thank you very much for taking the time out of your day to talk to us about this program.
You're very welcome.
So first question, please tell us about yourselves.
So hi, I am Naureen Kabani. I am a clinical assistant professor of rheumatology here at SUNY Downstate Health Sciences University. I have been part of SUNY Downstate for almost 10 years now. I did all of my training here. I did my residency, chief resident year, as well as rheumatology fellowship here. And I've been an attending physician here for the past 4 years. And before that, I was at St. George's University for medical school.
And I'm Grace. I'm one of the third-year medical students here at SUNY Downstate, just entering our clerkship part of medical school. I've actually been at Downstate for a number of years as well, because before I started in medical school, I worked with Dr. Kabani and Dr. Ginsler in the rheumatology department as a clinical research coordinator. So I've been here for, I think, going on 4 years now. So I'm pretty familiar with Downstate and happy to be speaking with you today.
Awesome. So next basic question, when did you first decide to become a physician and why?
So I first decided to become a physician when, after college, I didn't go straight through. I took some time to really make sure that I was passionate about this journey, because it is a journey. It is a hard journey, and you have to know that you're in it for the right reasons and that your passion can carry you through. But I was doing some clinical trial I was working as a clinical trial coordinator for a few years. And just in the interactions with the patients, realizing that I could make more of a difference as a physician and provide the care that they really need. That's when I decided, and that's when I applied and started my journey.
Mm-hmm. Yeah, somewhat similar for me too. I mean, I'd always been really interested in the medical field from when I was a really young kid. I think I was probably 5 years old when I started saying that I wanted to be a doctor when I grew up. But I think, when it's not until you really see medicine for what it is that it's if you want to do it or not. And through college, I had some clinical experiences. I volunteered at Bellevue in their emergency department and saw the impact that you can have on patients. And then coming here to Downstate and working with the rheumatology department, that was really ultimately what cemented it for me and showed me that, yes, this is really the journey that I want to take. And having these interactions and building these relationships with patients and seeing them over and over again and helping them take control of their health is really what drew me in and kept me on the path, because I also applied a couple of years outside of graduating from college.
Awesome. Thank you. So, Ms. Shadid, what attracted you to SUNY Downstate's program?
Mm-hmm. Yeah, I mean, for me, it was absolutely the patients. I had started working at Downstate in the rheumatology department in, I think it was 2019. And I was working part-time as a study coordinator, and it was my very first day in the clinic. I still didn't really understand what lupus was. I looked it up, I'd researched it, and I still didn't quite get it. And the first patient that I met on my very first day in the clinic just pulled me in to her room and said, let me show you what I've gone through. Let me show you what my disease has meant to me and means to my life. And, she let me feel her joints. She told me about all of the complications that she's had. She told me about the doctors in the very clinic that I was standing in who have been treating her for decades. And so when I saw that this is what the patients at Downstate are like, I didn't really want to go anywhere else for my medical training. I think it's a huge privilege to get to treat patients. And I think the population here, they bring students into the care and they say, no, you're a part of this team and I'm going to teach you about what I'm going through. And so I think as long as we're willing to listen to them, our experience here is really profound. So that it was the patients that really made me want to come here, and I didn't really want to go anywhere else.
Perfect. So, Dr. Kabani, can you tell us more about the Patient Navigation Program at SUNY Downstate, please?
Yes, of course. It's a really wonderful program that we've partnered with Janssen on, and it's creating a patient navigation program to support patients of color who specifically have psoriatic disease. So that's plaque psoriasis as well as psoriatic arthritis. And we enlist second-year medical students from SUNY Downstate, like Grace, to serve as patient navigators across both the rheumatology and the dermatology departments. And we help them obtain the resources that they really need. And we do this because patients of color really have more obstacles to overcome. They often face delayed diagnosis, they have misdiagnosis, they have more limited access to care, to testing, to treatment, limited access to care coordination. So our student navigators are really helping plug these gaps in care, and they're helping their patients overcome these obstacles. They're a trusted resource for the patients. They ensure that the patients have someone to turn to verify their management, to help get in touch with their care providers, to help coordinate their care, and hopefully ultimately achieve better health outcomes.
Awesome. So, Ms. Shadid, how did you learn about the Patient Navigation Program in SUNY Downstate's Dermatology and Rheumatology department?
Mhm. So I was pretty lucky in that I had sort of a direct connection. The rheumatology department actually started the Patient Navigator Program first, and I was on my way out of being the clinical research coordinator with Dr. Ginsler and Dr. Kabani, and I was on my way into being a first-year medical student. And Dr. Ginsler really just said, "Look, like we are starting this program. This is what it's going to be." And I'm going to need somebody to help us sort of coordinate the day-to-day logistics of the program. Are you interested? And I don't think she finished asking the question before I said, yes, absolutely, I'm interested in doing this. And then within that first year, conversations about starting a dermatology program started. The conversation started there as well. And it was the same thing. I was happy to start and eager to begin as soon as possible, just because at that point, I had seen the impact that it was having on myself as a medical student and on our patients. And I thought, if we can build this into another department, I think even better. So I learned pretty early on and don't have any intention of stopping.
Awesome. So, Dr. Kabani, what deficits in medical education and training does the program address?
So, there's deficits throughout the medical training process. So, first of all, in medical school, there's only recently been more of a trend towards discussing health inequities and culturally competent care in the classroom. And sometimes it's just very tangential. And then even further along in training, so in dermatology residencies, surveys have found that 75% of residency programs provide no lectures on skin of people of color. And that, different diseases can present differently in different skin types. So having no exposure to that is very limiting. And then in rheumatology fellowship also, a survey showed that 30% of rheumatology fellowship programs provided no training in cultural competency or health literacy. So we know that there's gaps there. So our program, we know that in addition to helping the patients, is also helping the students get more of an experiential learning process to get the hands-on training and actually the doing of helping plug some of these inequities, caring for these patients who are at risk. And hopefully the students will carry on these skills to their future careers as physicians.
Awesome. So, Ms. Shadid, what are your responsibilities as a patient navigator, and how has the program helped you to better develop your cultural competency skills and ability to deliver care?
Mhm. Sure. Well, I mean, the patient navigators are really like liaisons to the patients. And so the relationship with each patient and the needs that each one has, they might be a little bit different. I think in general, what we do as navigators is we are in frequent communication with our patients. We remind them of upcoming clinic appointments. We'll check in with them after an existing appointment to see if they have any questions, if there's anything that they need to do to follow up. Oftentimes, they will have referrals to other clinics here at Downstate, and they might not know how to make those appointments. And so we'll help them sort of navigate that system. We'll remind them to pick up their prescriptions, or oftentimes the prescription will be sent, but maybe there's like a lag in the system, or it was sent to the wrong place. And so if the patient is there at the pharmacy and we find out, we can contact their doctors more quickly and help make sure that that prescription is sent before the patient has to go home and come back to the pharmacy the next day. So we're really just there to sort of facilitate all of these next steps in the medical process and make it easier for patients to stay on track with their care. In terms of the cultural competency skills, most of the patients that are enrolled in our program are Black patients. And so from our perspective as students, we are really learning how to support our patients. We're learning how to treat every patient as an individual, to discover what unique challenges they're facing in their own life. How do they want to be addressed? How do they want us to communicate with them? I think it's really just those kind of one-on-one interactions and real-world skills that we get to develop as patient navigators, because sometimes it seems like it shouldn't be that difficult to learn how to speak with patients, but sometimes it can be really challenging when you're a new third-year medical student. You're trying to figure out what the disease is, what the diagnosis is, trying to coordinate all the labs, and sometimes you just forget that you're speaking with the patient. And I think through Patient Navigator, we really learn to put the patient first. And those skills I'm finding between me and the other navigators are really translating into third year, where we're remembering to keep the patient first, and sort of translating those cultural competency skills onto the wards as well.
Awesome. Thank you for breaking that down for us. And Dr. Kabani, how can medical students, residents, and attending physicians get more exposure to training around cultural competency and caring for patients of color?
Well, I think the first thing is they need to take the time to realize that this is very important information and knowledge that they need to have. And one resource that I would love to talk about today is something created by Janssen and Determination, which is an initiative that was led by patients and advocates and healthcare providers that have come together to develop solutions to address the inequities in care that impact specifically people of color with psoriatic disease. So the textbook that they've created is called Beyond the Textbook, and that has a lot of different resources, including just background information on systemic inequities faced by people of color, the best practices for inclusive communication, tips for healthcare providers to better diagnose psoriatic disease in patients of color, as well as medical images that show how psoriatic disease can show up in different skin tones. So it's a great resource, and medical providers who are interested can learn more and download this free resource called Beyond the Textbook at www.determinationwithadash.com.
Perfect. So thank you for taking the time out to speak to us about this. That was all the questions I had. Are there any, parting thoughts that you would like to give right now?
I would just like to say, as an educator, a medical educator, to the students of Student Doctor Network, that you guys have a lot of power and you guys have a lot of voice in doing things for your patients, and hold on to that and do with that energy what you would want done for your own family. Be the advocate for your patients, look for the gaps in healthcare, and be the change, be the plugs, the solutions. So good luck in your careers.
And I'll just give some parting words as well. I'm at the very beginning of my third year, so I'm still trying to learn the ropes of what it means to be a third year medical student and how to navigate the different clerkships, how to, fit my way onto different teams and all of those things. But I think the biggest thing that I try to remind myself is really to put the patient first And on the days where I feel maybe a little bit stressed because I have a lot of work to do, or I'm not really exactly sure what my role needs to be on this team, I always go back to the patient. You know, if I've got time before the OR, before the case starts in the OR, I just go speak with the patient in pre-op and I ask them, you know, what brought you here today? Why are you getting this surgery? How much pain are you in? What is it like, you know, going through this? And I think there's a lot that I've learned from just having those conversations with the patient that I wouldn't have gotten from the medical charts. You know, you always try to go into the chart and learn about the patient and all of this stuff, but I really save myself a lot of time, I think, when I just, you know, do whatever chart review I need to do, but go speak with the patient because they know their disease better than anybody else because they're the ones who are living with it. And so I think for any students that are, you know, starting their clerkships, just remember that the patient knows more about their health than probably anybody else, and use them as a resource and partner with them in that.
Awesome. Great feedback. Thank you. So again, Dr. Kabani, Ms. Shadid, thank you very much for taking the time out to speak with us about this. We appreciate it.
Thank you, Kyle. It's been a pleasure.
Thank you.